Welcome, everyone. Welcome to podcast number 12. And we're continuing on our theme of head to toe of health. So today we're going to be talking about our senses. So the major ones, our sight, our hearing, and our sense of smell. So Sue is here with me today. Isabel is not able to join us.
Thanks, Celeste. And so hopefully when we're just the two of us talking won't be as boring for everyone out there. But today we just want to discuss, as Celeste said, the eyes, the ears, and the nose, and probably just, I don't know, I think they get a bit underrated and not noticed because
yes,
they have, they have a super function, and we have all of these senses because they keep us safe. Those senses are really important because without them, we would have a lot more slips, trips, and falls. They help us see hazards, like our vision helps us see hazards. Our hearing helps us hear hazards. We can sense danger approaching. We can smell poisons or fire, so we can get ourselves out of danger. And so it is really important that they're intact. And that's why our children, we have to protect them because they're developing their senses. And so, they need sort of adult supervision to make sure that they're safe. And then in the elderly, because as we age, these senses start diminishing. So, we lose our sense of smell, potentially. We lose our hearing. It sort of deteriorates with age. And so we get some safety issues as we age as well. So you can see at the opposite end of the spectrum how we have to care. And I think this is super important for us when we're caring out in the community and in hospitals and wherever we do care, that we remember, we know what it is. At my age, I know what it is to have full intact senses, although my eyesight is deteriorating with age now and I wear glasses, as does Celeste. We have to, we have to be mindful of that and know how to keep the good eye, ear, nose cares happening, so that we can, keep our optimum function and we can live well with any deteriorations that we might have over time, because that's the whole deal of life. We want to live well. I mean, we can have illnesses, we can have disease and dysfunction, but how do we live well with it? Like, that's what this is sort of, I guess, I'm hoping we can talk a bit about that today too, Celeste.
Yes. I hear what you say, Sue, about how we don't think too much about our senses. I think we take it for granted that when we've always had good vision or good hearing and our ability to smell and taste things, because it's always been there. It's like having two legs and being able to walk. And then we forget when it's, we're caring for people who might have impaired senses. It's that ability to put ourselves in their shoes, to pull up and think, oh, hang on, I wonder what that must be like to not be able to smell the meal that comes in, or, and how do you get someone to eat when they have no sense of smell and taste, and making sure that they're aware of what's happening around them when they can't see very well. So
exactly. So and I think because there is so many different ways our senses can lose function, and there's congenital abnormalities, and we're not probably going to break them down and go into every one of them because it's voluminous. Okay, and the congenital abnormalities, there is a lot of care and treatments that go in for people to look after that. Like, I'm in, top of mind that comes to my head is, children who are born deaf with congenital, abnormalities. And so, they might require a cochlear implant to hear, that sort of thing. A lot of, premature babies, they end up with some abnormalities because, they've come into the world a bit early and haven't been able to develop in utero as expected, and so that puts a lot of stresses on the senses, and so they require a lot of support and care to get those senses to work the best that they can as they develop and grow up into adults. There's trauma. Trauma is a massive effect, affects our senses a lot. And we talked about traumatic head injuries in episodes 9 and 10. So, you can see how massive head injuries, when our eyes, ears, and nose are all in the head, you can see how a heavy head knock can take away that nerve that, is our sense of smell.
Yes, because it's any part of the pathway, isn't it? I mean, the actual sensory organ is in our head, like ear, nose, our eyes, but then they could be intact, but there's something that's happened to the nerve pathways within the brain.
Exactly.
And that takes out that sense or impairs it in some way.
Yeah, I mean, I had a friend who used to be a baseballer, and he got hit in the head too many times. Even though he wore a helmet, and he wore his safety gear, hit in the head a few too many times with a baseball, and he actually lost his sense of smell.
Oh.
So, so it's trauma is something that we do run into every day. Abnormal cell growth, so tumours, viruses, and interestingly enough, through COVID, a lot of people temporarily, due to the COVID virus, lost their sense of smell.
Yes, I've got a bit about that when we get to the nose.
Yeah. So it can be a lot of things. Sometimes the medications we're taking can take away our hearing. I know when I used to work in infectious diseases many years ago, we used to use a drug consecutively called tobramycin, and that was one of the big things. We were always monitoring patients' hearing because it really could take away a patient's hearing quite quickly, and it was really our job to notice if they had any hearing difficulties while they were taking that drug. So there is a lot of things out there that we might do differently for just a period of time that can take away our senses as well. Hopefully, if we notice them quick enough and change the medication, we can get full hearing back. Chronic diseases, definitely. I mean, diabetes, you think about diabetes and diabetic retinopathies. Basically, we lose those small little blood vessels that, leak and bleed because of our diabetes. Basically that will take away our vision as well. So there is, and heart disease, because of the, like significant hypertension that can cause some changes in our vessels as well in our eyes, so we can lose sight as well. So there is a lot going on. There is a lot of things that can impact it, but are we aware of that is probably the thing.
$1 million question. Because can be over time, and particularly the hearing loss, I think, is one of those things that sneaks up behind you. And when you already have a degree of hearing loss, then you're not aware of loud noises. Sometimes noises can seem overly loud to you at certain pitches, but most of the time we don't notice. And so if we forget to put the earplugs in or the hearing protection, we don't realise that we're actually making our deafness worse when we pull out the hand tools. And
exactly. And sometimes, like what you just said there, when we actually we notice a particular pitch is really irritating, but everyone else seems to be okay, that's actually an indicator that our hearing's changing.
Yes, right.
So our auditory processing function, which is part of our hearing, is changing. It's the same as, older people, if they're in a really noisy environment, they can't hear you because their auditory processing centers are being affected. So all of that loud noise becomes bigger than that, and therefore they can't focus on one voice. So that's actually a hearing deficit as well. But there's finer details of everything. And so that's where, to notice, to have the knowledge to know this is different. I need to get this checked out is probably where we're going today. And, I know as a nurse, I notice this stuff. So I'm the one who notices it in my friends. I'm the one who notices it in my family. and in my patients, I always used to notice it as well, definitely. So I'm that annoying friend or, family member who goes, are you right? Like, you just don't seem to be hearing when I talk. Is it just my voice you don't want to hear? What's going on with that?
Oh, yes, Sue, get off my back.
Yeah. Oh, shut up. Here she goes again. So
Yes.
it is really important to just be, just check in with people. Be annoying is my motto. Anyway,
Be curious.
Anyway, so the first sense we want to talk about is the eyes, because they're incredibly complex, and I just do think we take them for granted. They're really highly productive organs. They do a lot, and amazingly resilient, considering how much we don't look after them, how much they keep working. Okay, so isn't that interesting? They can adjust to different conditions and environments immediately. So we can go from light to dark. We can look at things far away to short distance. Like, they can pretty much, they are the most flexible organ we have. Okay. And the muscles that move your eyes, interesting fun fact, are the fastest and strongest muscles in your body relative to their function.
Isn't that amazing? So that's the muscles around the eye, like the orbital muscles.
So they are 100 times more powerful than they need to be.
Wow.
Isn't that, like, I just love these fun facts, because I just think, wow. And how do we care for them?
Yes, yes.
Well, I think, I know I probably don't care for mine as well as I should. I mean, I go stick makeup around them and stick sticky pretty powders all around them, and I go colour them in, and so I'm actually putting toxins around them all the time, and I don't know if they really like that, but apparently they're putting up with it. But so there's these mindless things I'm doing every day, and after doing this, sort of putting these fun facts together and looking at statistics and stuff, I sort of went, oh, geez, maybe I haven't been as mindful with my eyes as I should have been.
Yeah, like, how long is it since we changed our mascara? Or like,
exactly.
I think it's supposed to be every 6 months, or
no, apparently it says now every 2 months.
Oh, wow.
Yes, you're not meant to keep your mascara for more than 2 months. Sorry, all the people out there using mascara. Fun fact. Yeah, so great for the mascara industry.
I mean, you shouldn't have eye drops for more than 30 days if you're keeping them in the fridge. So once they're opened, so that makes sense.
Yeah, so all your eye makeups and all those sorts of things, high turnover people, if you want to just reduce it, your risks of, infection, problems, are they safe putting all those powders? I mean, look at Johnson & Johnson talcs and all the litigation against them these days for talc. I mean, are we going to have that problem down the track with, eyeshadow? I don't know. Just a question. Anyway, I digress, as I like to do. But there's, over 13 million Australians had one or more chronic long-term eye condition in 2017 to 2018. So, as you know, I always like to get some facts from the Australian government, Australian Institute of Health and Welfare, about, how Australians are living with, their eyes. And, the data from the current years is still being established. So that's why the most recent data they have is 2017, 2018. But long-term vision disorders affected 93% of people aged 65 and over.
Wow.
So here we go. So if you're over 65 years of age, you are going to have some sort of long-term vision disorder. And that can be long-sightedness, short-sightedness, stigmatisms, focusing issues. There is a long list of what that is. But 93% of our people who are 65 years and over, it is significant. And, and that's inclusive of cataracts, macular degeneration, blindness, complete or partial. Like, it's all of that. So I just think, wow, I probably I think about all the people I've cared for her over the age of 65, and I probably haven't really understood that.
Mm, mm, mm.
So
No, that's
93%,
true.
yeah, it's
And so
amazing.
even if they're not necessarily wearing glasses, that doesn't mean that there's not some kind of a deficit there. It may not have been
Exactly.
identified. Maybe they didn't go to the optometrist. Maybe they've just found ways. It's amazing how we human beings find ways to adapt to our environment and the resources that we have, and we just sort of keep going. And
Yeah.
little things deteriorate.
And so simple things like I think about times, when I used to put a patient's bedside table next to them,
Mm,
and they'd say, I need a drink of water. And you go, oh, yeah, it's just in front of you on the bedside table. And yet they couldn't see it because their glasses were next to them on another bedside table that they couldn't reach. And so their visions were so poor, everything looked like blurry blobs in front of them. So,
yeah,
how often are we doing that to patients at the bedside where we just, we've
yes,
taken their glasses off for some sort of treatment and then not given them back and put them so far away they can't get to them.
yes, yeah,
You
like
know,
the breakfast
well,
tray.
I can smell breakfast is here, but I can't see it. I mean, patients in
Exactly.
hospital are malnutritioned as it is if you look at the statistics, and then I don't give them their glasses so they can eat their food.
Yeah.
Anyway, so this is the stuff that we probably need to be mindful of. And interestingly enough, females, 59% of females experienced higher prevalence of long-term vision disorders than males. But there was some data in there to say that, females actually have higher healthcare standards. So they actually notice changes and will actually go and see someone to get support, as opposed to men who will not seek support.
Mm.
So
So
whether
maybe a diagnosis thing, do you think?
yeah, so whether it's whether that's women will seek care, whereas men will just go, oh, she'll be right.
Yep. Yep.
So that's what the data reflected. It sort of said, yeah, maybe that's part of it. But I don't know. I just find that sort of data, it's really interesting, and how macular degeneration is really on the rise in Australia as well, and about 411,000 Australians have cataracts.
Yes, really
Cataracts, which
common.
required,
Yeah.
So, and it's because we live in this bright UV drenched country that we have such high incidence in cataracts in Australia as well. So I find that
Mm.
interesting. I don't
Mm.
know.
What about the macular
And I guess,
degeneration? Wonder what's behind that.
well, I think that because macular degeneration is impacted by eye care.
Mm-hmm.
So people not seeking eye care, but also a lot of there is a lot of factors that impact it today with our modern society as well. So, and disease, and the fact that we've got we're living longer, but sometimes not healthy and well.
Healthier. Mm.
Yeah, so we're living longer but not healthier, and that's having an impact on all Australians as well.
Yes.
So I guess that brings us to that point of so what is great? How can I look after these beauties that are helping me be safe and everything like that? And so, the generic information is to get eye checkups every 2 years with your optometrist or your ophthalmologist. Now, for me, I wear glasses, and my glasses are bifocal, so I use them for long distance and short distance. So I have different transition lenses in my glasses. And I'm a regular visitor to my optometrist every 2 years, and I get them checked. Sometimes over the 2 years, I haven't really had any significant changes, so I don't need new glasses. And then sometimes I do. It just depends. And so I leave that up to the professionals to decide that. So this is, and it doesn't, under our Medicare system in this country, it's actually free.
That's right.
So pop to your Specsavers, guys. Get your eyes checked It doesn't cost you any money. And I think what I find interesting is I don't know how many nurses I've worked with over the years, but you know the ones who you ask them to check like the S8s with you and they'd hold the vial out here and their arms, and they'd say, oh, my arms aren't long enough anymore to read this. It's not funny.
No.
It's actually a problem. Like,
yeah,
go get them checked.
That's when
like,
I had to go and get my glasses and then
yes.
the bifocals, because you put them on to read and then you're taking them off and then, oh, I've got to wash my hands now before I can actually draw anything up. Like, what the heck? So, yeah. Things
So,
had to
no.
progress quickly.
Yeah. So it is. It's so when we notice those things and we're laughing them off, yeah, a little bit funny, but could you just pop into Specsavers on a day off and just go and get checked out? You know, they're everywhere and they actually have quite good availability of time slots too.
They do. And actually, at the risk of sounding like I'm plugging the product or business.
Sorry, and I shouldn't say we're not being paid by Specsavers. We're not being paid by Specsavers.
They will test your hearing as well. So bonus.
Exactly. I know. So this is the thing. And they've got the equipment. It actually doesn't even take that long. I know it takes me longer to get if I need glasses, that takes me long, but that's my own pure fussiness. That's not because it takes that long. I'm a fusspot. So that's what takes me so long. But I would encourage everyone, just if you haven't done it and, you know, you're sort of noticing that things maybe are not as clear, as crystal clear on the telly as they used to be. You know, when you clean your bathroom, you're not probably cleaning it as well. Those sorts of things. These are the little things that we're noticing. Just go and get your eyes checked. It could be something so minor, might be eye exercises. It might be something that's well within your control to sort out. The other big thing that we've got in this country more so than any is protecting our eyes from UV light. As I said, with cataracts, that's the biggest sort of factor we have. So hats and sunglasses, people, wherever you go outside, you know, we live in, you know, our ozone layer. That's why our UV light index, and we have so much skin cancer in this country, because we've got a big hole over Australia, and that's why we burn phenomenally. So hats and sunglasses. You know, maintain a healthy lifestyle, eat well, exercise, all those things we talked about in previous podcasts. Hey, Celeste.
Yeah. Absolutely.
What podcast numbers were they? You know, remember we talked about movement, nutrition, sleeping.
Yes, I think that was around
earlier.
4, 5, and 6.
Yeah. So go, you know, just, you know, if you're finding that you know, like that you're drinking too much alcohol and you're smoking and you're vaping, all of those things really dry out the outer aspects of our eyes. Ethanol, of course, is a toxin that we have in alcohol, and the smoking and the vaping puts mists and, you know, contacts over that sort of sclera, which is quite damaging progressively over time as well. And yeah, you know, just get those eye examinations out there and done, really, I think is probably the big key there. Have you got any other ideas that?
No, I think it's probably a good idea. It's a good idea just to get your eyes tested, you know, like at some point, like once you're 30 odd, because you just don't know what you don't know. So it's just a health screening.
And it's such a sly progressive thing, those losses. You know, because sometimes we just notice a bit of a tension headache in our forehead.
Yes.
And we go, oh, I'm just tired. I've been working hard. It's because you can't see properly and your eyes are working so hard. Those muscles, remember at the beginning I said those muscles are 100 times stronger than they need to be. Well, what happens is they start working super hard, right? And they're working and flexing, focusing. So they're running a marathon just in here in your ocular sort of orbital space. So then they get tension and they need a massage, right? And so, but you can't give your eye muscles a massage because you can't stick your fingers in your eyes. But what you do get is this tension across your forehead and this pain. Go get your eyes checked, people. Is that our public health message today, Celeste?
Yeah, I think so.
Awesome.
Put it out there.
And
get hearing tested.
Yes. And in the link, when we post the podcast up, we'll actually put some really good links for you to get more information. If you have some queries about macular disease, there is Macular Disease Foundation Australia. They have a lot of really great information to support people with macular degeneration. Also, glaucoma is a really big common thing that we're seeing too now, and there is a lot of therapies and eye interventions that can be done so that these don't become an ongoing issue. So you can live with any sort of degeneration of the eyes, because interestingly there is a lot of treatment paths. So it's kind of, but you've got to identify the problem to get on the treatment path.
Well, thanks everyone for joining us for the podcast today. It's been a hoot. And please remember to like, share, subscribe if you've liked what you've been listening to today. And if you've got any suggestions for us for future podcasts, please drop them in the comments or contact us on our Facebook page. That's called What's with Healthcare. And we'll talk to you next week. Bye.